So in this clinic, I act as the laboratory director. So I oversee both the andrology laboratory as well as the IVF laboratory. We are responsible as a laboratory for all of the patient testing that is done. And so while the physicians will develop treatment plans, part of being able to monitor whether those treatments are being effective and so forth is being able to analyze whether it's chemistries and it's looking at hormone levels within bloods and so forth. And so we'll do that in the andrology and the chemistry lab. And then in the IVF laboratory, obviously we're helping those patients that are in need of more intensive procedures where we'll be doing everything from the retrievals to developing, watching the embryos develop to preparing for embryo transfers. The day that a patient comes in and they're here for a pregnancy test, and to see a patient who has struggled, some of the patients have struggled for years, and to see the excitement and the joy in their face when they see that they're finally pregnant. It is the first step in that patient's journey to parenthood, and to help them potentially realize their family dreams. That is something that is the favorite part of my job. It brings me the most excitement. Unlike a lot of fertility practices, the difference with our academic practice is that we are really focused on our patient and the needs of our patient, and we're not going to try to force a patient into one particular treatment option. We're going to go ahead and work with that patient however they need for as long as it takes to help them meet their needs. If a patient is nervous or hesitant, I would say that is perfectly natural. In general, about 20% of the population is dealing with infertility. And so what a patient should realize is that they're not alone, and that this is something that does affect other people, and that they should take the steps to meet with us, and we are there to help them, overcome that.